Aloha and welcome back to the Kupuna Connections program. I'm Cullen Hayashida, and this program is brought to you each week at this time to share information about how we can provide care to our older adult populations using local experts. This week we have a very important topic having to do with Alzheimer's disease and dementia, and how do we cope with this situation and this disease. And before we get started, let me have my co-hosts and my guests introduce themselves.
I'm Toni Hathaway, and I'm a social worker and the education coordinator at the KCC Kupuna Education Center.
I'm Christine Payne, and I'm the Director of Programs at the Alzheimer's Association Aloha Chapter.
Hi, I'm Lisa Choquette. I am the Oahu Program Coordinator at the Alzheimer's Association.
Well, we're talking about Alzheimer's disease and dementia today. So first of all, can you tell us about some of the trends related to people with dementia? We've been hearing a lot lately. Are the numbers going up or are they going down?
Well, the numbers are increasing for several reasons. One of the first reasons is because people are living longer, and since age is the main risk for acquiring Alzheimer's disease, we're seeing that the numbers are increasing for those reasons. We also see that the numbers are increasing because I think public awareness about the disease is spreading, and so now people know that some of the symptoms aren't related to just typical aging, but actually because of the disease. And so a lot more people are going into seeing their physicians and saying, we recognize that some of these symptoms are occurring and we think it might be Alzheimer's disease or dementia, and we would like to see if it is. So I think for those two reasons, we're seeing an increase in the number of people.
Do we have
diagnosed.
any kind of information about the numbers? How many people are we talking about?
Yeah, currently it's about 31,000 people within the state of Hawaii that have Alzheimer's disease. So it is a pretty significant number when you look at the size of the population overall.
Okay. Now, what kind of impact is this having on Hawaii? I mean, we talk about the fact that we're having more and more people with Alzheimer's disease, but what does that mean in terms of what consequences is this having on Hawaii?
Well, there's a lot of consequences in terms of family members, at the very, lowest level, I guess you would say, for each family member or a household that is dealing with this, that it's very taxing on the individuals who are providing care to a loved one with Alzheimer's disease. We also see in Hawaii there's a lot of retirees and seniors who live alone. So for somebody who lives alone and doesn't have family members here, they may be on the mainland or they just don't have any, they're trying to coordinate their own care and take care of themselves as long as possible in their home. And so they do need a lot of help and resources to be able to do that.
Okay. Well, sometimes the terms that we use are a little confusing for folks. So what exactly is Alzheimer's disease, and is it a type of dementia?
Yeah, it's a good question. That can be very confusing for people, and oftentimes they don't know what the difference is between dementia and Alzheimer's. So I'll go over dementia first. Dementia.
We have a slide up there that we
Okay.
can see, perhaps.
Great,
that might
great.
help. Yeah.
So the term dementia is a medical condition which basically describes a loss of cognitive functioning. So we'll see that as memory loss, confusion, a decline in problem-solving skills, and usually there's a decline in judgment. So there's reversible types of dementias and irreversible types of dementias. What we're talking about with Alzheimer's disease is a chronic, progressive, irreversible type of dementia. Sometimes people do have reversible types of dementias that can be treated. That could be due to medical conditions such as dehydration, malnutrition, chronic major depression, some low functioning thyroid. All of those types of medical conditions can cause symptoms of dementia. But when we look at the irreversible dementias, by far the majority are Alzheimer's disease. About 60 to 70% of all progressive chronic dementias are Alzheimer's disease.
I guess that'd be an important reason why you'd want to make sure and have it checked out, so you
Yes.
know if you have Alzheimer's disease or perhaps one of these reversible type that they can treat.
That's definitely the first thing that I talk to families about when they call, and sometimes they think, oh, it's just, my grandma's 85, so of course this is going to happen. And we really want to emphasize with people that it's important to see a doctor and make sure if there's any treatment that can be provided to reverse those symptoms of dementia, that they do that.
One of the slides that we do have that we can see is the various types of dementias, I guess, reversible and irreversible. Perhaps you can kind of clarify some of these.
Sure. So as I was saying a few minutes ago, of the irreversible dementias, Alzheimer's is the most common, about 60 to 70%. The second most common would be vascular dementia, and that's related to having strokes or mini strokes. Generally, that's somewhere around about 15 to 18% of the population that has an irreversible dementia has vascular dementia. Interestingly, here in Hawaii, we probably have a little bit higher percentage of people because it is more common in the Asian population to have a vascular dementia. So, as I said, there's other rare types of dementias too that are irreversible that would affect a very small segment of the population. And that could be related to Lewy body disease is closely related to Parkinson's disease. Wernicke-Korsakoff's has to do with a chronic deficiency of thiamine, and a lot of times it's associated with long-term alcohol abuse. Frontotemporal lobe dementia is a type of dementia that just affects the frontotemporal lobe, which so you'll see a lot more behaviors and judgment issues that will come up rather than just memory loss.
Well, and sometimes you can have combinations.
Yes.
Right? It isn't always just one or
Yes.
another. Like, it's not too unusual to have Alzheimer's disease and to have had some strokes, possibly.
Yes, that's very true, which we call mixed dementias. And it can be difficult to separate one from the other because the symptoms may be very similar.
But it's good to know that some are reversible.
Yes.
That, we sort of assume that it's irreversible and perhaps become pessimistic when in fact there may be hope.
Yes, definitely. I can't tell you how many times I've had families call me in crisis and say, my mom just got Alzheimer's. She's having all of these horrible symptoms. She won't go to sleep. She's, talking nonstop and wanting to get out. And I always, recommend that they go to the emergency room as soon as possible because there are infections that can cause those types of symptoms that are very severe. So, and that's very treatable if it's symptoms like urinary tract infections. It's very easily to treat that.
Right. Well, I guess that's an indication too. If it's sudden, it's probably
Yes.
not Alzheimer's disease because it takes a long time.
Exactly.
But people just get scared when those symptoms come on, and you really do need to get it checked
Yes.
out. I guess that's the really, really important thing to get
Definitely.
across to folks.
Yes.
We have this one other slide that actually shows a cross-section of the brain. I thought maybe you could explain that.
Sure. So what we see at the top left-hand corner is a cross-section of, and this is upon autopsy, of course, a cross-section of a brain from a person who's elderly but is healthy and doesn't have any signs of Alzheimer's disease. And then on the bottom right corner is a cross-section of a brain of a patient with Alzheimer's disease. So you can see, right away it's very distinct where the brain has shrunk. There's those large portions of the brain that have been destroyed and are basically there's nothing left of the brain, especially in the very center of the brain, which is the area that Alzheimer's disease starts out in, the area that controls memory loss and judgment.
I think that's a great slide to show
Yes.
because I think it really makes an impression on people as to why someone with Alzheimer's displays some of the memory loss and some of the difficult behaviors that they do. because I think sometimes it's really hard for families to understand that. When you see that slide and see how much damage there
Yes.
is, it seems much more understandable.
And this is characteristic of Alzheimer's disease.
Yes. Yeah, and I agree. That's the reason why in a lot of my presentations I show that slide, especially for family members who are really struggling with the symptoms and they think maybe the behavior is purposeful, that the person with Alzheimer's is asking the same question over and over or being argumentative. And so it's important that they see this isn't purposeful behavior. It's the result of a brain that's being destroyed by this disease.
Right.
And it's irreversible, like you said.
It is.
Unfortunately.
It is irreversible. It's chronic. The symptoms will progress over time. It's usually a slow, steady progression, but that depends on the health of the individual otherwise. But it is eventually fatal.
Okay. Could you share a little bit about some of the warning signs? Maybe, at the early stages, what should we be looking out for? We have a slide that you brought that shares some of that information.
So one of the first things that happens when somebody gets Alzheimer's disease is that you'll probably notice that there's some lapses with short-term memory. And so people always ask us, well, they can't remember that they just ate lunch, 10 minutes ago, but they sure do remember, 40 years ago when I made them mad when we did a certain something.
Right.
And we explain to them that where the short-term memory is stored is usually different from where long-term memory is stored. And so you might see some inability to remember things that they just learned, and in addition to seeing changes in mood or behavior, changes with being able to stay focused or plan very well. And I always say though that if they weren't a good planner before and they're still not a good planner now, that's not a warning sign. But if they were typically somebody who was good at maybe planning family parties or activities, and now all of a sudden they're not able to do those sort of tasks, that's an indicator. You'll also, like I mentioned, see changes in mood and behavior. So maybe somebody who used to be a lot more sociable and vibrant is now, socially withdrawn, has anxiety or depression. Other changes include, inability to see very well with spatial concepts or contrast of colors. So you might see somebody who's getting into more accidents, who's still driving and maybe starting to all of a sudden have a couple of dings here and there in their cars because they're not able to estimate the distance between, the car and the next car or gates. You'll also see changes in regards to being able to pay bills on time or, remember specific events. There's also going to be disorientation with time or place. And so a lot of people will say, it's okay that they drive because it's only during the day. And, we always remind them that whether it's during the day or at night, they can still become disoriented even in a neighborhood that they've lived in all of their lives. And, you often see when you talk to somebody with Alzheimer's disease, maybe you can ask, what year is it? They may not be able to give you the right year or the right day. And again, it's one of those things where, if we all have those moments where, you go, okay, well, what day is today? And you have to kind of think about it. But you remember what day it is. Somebody with Alzheimer's disease or dementia will probably not be able to, take a moment or two to think about what day it is and then be able to give the correct date.
I carry my cell phone with me. I had my family member that was really good at making sushi, rolling sushi, and there's steps involved. You got step one, you got to cook the rice and and make all of the ingredients and then roll it. And if you get it out of sequence, obviously it doesn't work. And I recall my wife sort of saying, no, this is wrong, and then you've got this temper tantrum type behavior that appears. So yeah, it's kind of hard on the family oftentimes when that happens, of course.
Definitely.
Yeah.
So I guess if somebody is beginning to experience some of these warning signs, or if a family member notices that one of the elders in their family is experiencing a number of these warning signs, it really is important to get a diagnosis. So how do you get diagnosed with Alzheimer's disease?
Well, I think one of the most important things is for the family to start tracking some of the changes or the symptoms they're noticing, including how often it happens, how long has it been occurring, schedule that appointment with their physician and give that information to the physician. It's really helpful, I think, when you meet with a physician to say, well, this is, for the last 3 months, this is what's been occurring. These are the changes we're noticing, versus, sometimes they're forgetful, or sometimes they don't make the sushi correctly. When you're just giving them little examples like that, it's hard for a doctor to really be able to say, maybe this is something more. Once they meet with the doctor, share those symptoms, depending on what those symptoms are and how frequent they are, the doctor will probably then want to run a series of different tests. And basically he or she will be taking a look at the mental status of the patient, their physical health, see if they're on any types of medications, and then maybe possibly do an MRI or a CT scan. So there's a number of different tests that an individual will have to go through in order to get the diagnosis, because there is no one test that will say with 100% certainty that somebody has the disease. And so basically what the physician has to do is rule out any other medical problems that may be causing some of these symptoms to then be able to give a provisional diagnosis. And nowadays, with advances in medicine, there's a lot of physicians who can give a diagnosis with 90% certainty, which is really great.
Mm-hmm. Well, I guess that's really been one of the challenges is, really up until now, the only way to know for sure was to do an autopsy, and that's kind of a late time to really find out that you have this. So, now they really look at sort of ruling out other things until they come down with the fact that it's nothing else. So, given these symptoms, it probably is going to be Alzheimer's disease. And I know they're developing some scans that can do that, but they're not really readily available unless you're in a research trial of some type. But that has some very promising aspects to it, because we haven't been able to diagnose Alzheimer's disease till it's really quite far along. It's sort of like diagnosing cancer when you've had it for a few years, and that's kind of a late time to treat.
Do you go to a special doctor or any primary physician to have this diagnosis done?
A primary care physician can give you a diagnosis of Alzheimer's disease or dementia. Some may feel comfortable running the test themselves, or some may make a referral to a neurologist or a geriatrician. Okay. So it just depends on the physician.
Okay.
Yeah.
And so a family can ask for a consult, essentially.
Yes. Yes.
I see.
Yeah. And that can be, I tell families this too, that, it may be that your family physician can diagnose it really well, but if you really just don't feel like, do you have some questions still, you should ask to see a geriatrician. You'll get referred to the geriatrician, they'll do a workup, and then they refer you back to your own family physician. So it's not like you stay with the geriatrician forever, but sometimes it helps to get that second opinion if you really feel like it's not not clear.
Yeah. We're firm believers in advocating for your patient rights, and so if you feel like there are some questions, or maybe your current physician is not skilled in this particular subject, that you would go and seek referrals to
It's your life, or it's your family's, your loved one's life.
Right.
Exactly.
Right. Well, it's not so easy. I mean, it's not so easy to make that diagnosis.
Here's another question having to do with now, let's say we know that mom or dad has Alzheimer's, or probably Alzheimer's, family's struggling and having some frustrations. What kind of support is there for? I mean, what can you do as far as providing support for the family as far as this is concerned?
Well, I think first and foremost, we hope that they will call us at the Alzheimer's Association, and we can help them with getting started on this journey, or if they're in the middle of the journey, helping them out with some services and resources that might be helpful to them. In the early stage, if a family comes to us and their loved one is in the early stage of Alzheimer's disease, then we really emphasize some legal planning, getting legal paperwork in place like powers of attorney, advance directives, that type of thing. Because
that's a really important
it is
aspect of it, that people often are not aware of.
Yes, yeah, and that needs to be done in the early
In the
stage.
early stages.
Right.
When the
Okay.
person with Alzheimer's can still understand what that means and consent to
Cancer, yeah. Good
Right,
point.
because they can then select a person to make decisions for them when they're no
Yes.
longer able to make
Yes.
those decisions. That's a really important aspect that people often just don't think
it.
about.
Yeah, and we really emphasize that the focus isn't on somebody necessarily taking over your care. It's for the individual to make sure that their needs are known. And so it's really them having control over their destiny in terms of who they want to help them out, provide care, manage their finances, and honor their wishes at end of life.
Okay. Mom and dad, or mom or dad is acting belligerent or is acting strange. How do I communicate with him or her?
So it is quite often that people with Alzheimer's become agitated or anxious. A lot of times that's out of a sense of frustration because they're not able to effectively communicate, the message they want to give. Maybe it's how they're feeling, that they're not feeling secure about where they are, they're confused. So those symptoms of aggression or even verbal aggression or physical aggression are usually come after the individual with Alzheimer's has not been able to make their needs known. So it's not necessarily the most common thing to happen, but it can happen. So what we really recommend is when those types of situations happen to try to figure out what the trigger is, because oftentimes you can look back after that type of behavior and figure out, it was at the end of the day and my loved one was tired and fatigued and maybe they were hungry because I didn't get dinner ready in time. Or it could be that the individual doesn't feel well, but they're not able to report that they have a headache or their stomach aches.
I see,
and
yes.
so they can't get the needs that they have attended to. So it's really more about trying to enter their reality rather than trying to bring them back to our reality and say, well, you need to tell me what's wrong, what's going on. Because if someone can't accurately communicate that, they're going to get frustrated and eventually start getting angry, and that's when you see the difficult behaviors
And there's
come
no
up.
sense arguing with someone with Alzheimer's.
Right.
No.
Now, what about activities? I mean, any recommendations with regards to any particular type of activity that's appropriate?
Well, I'm glad you asked that because that's a very important issue with people with Alzheimer's disease. A lot of families will report that their loved one with Alzheimer's wants to sit and watch TV all day. They don't really want to engage in things the way they used to. And so I have to explain to them it's sometimes difficult for someone with Alzheimer's to initiate a behavior or initiate an activity, so they really rely on others that they are familiar with to help them with that. It helps to keep an individual independent, to be physically and mentally stimulated. So walking, any kind of exercise like that, going for walks. If the person liked being outdoors and being active, then going to the park, maybe watching grandkids play, that type of thing. You want to find an activity that they enjoy and not try to force an activity that has never been that person's personality to do in the past.
Right. And I guess we often suggest simplifying the tasks
Yes.
too, right? One of the common things is to, instead of getting dressed in the morning and having them look in the closet at all the choices, you might give them
Yeah.
2 choices and ask them which of these 2
Yes.
outfits they'd like to wear today.
Exactly.
Something
So
like that.
activities should be geared at the level of functioning that the person is at. So what you do for somebody who's in the early stage is not going, there's going to be a different activity for somebody who's in the later stage and can't remember how to do a lot of those activities by themselves.
Right. We haven't really talked about any of the latest medications. Are there any medications that are out there now, or what should people know about that?
Yeah.
Are there treatments that work?
So there are a few medications that will help with it doesn't stop the progression of the disease, but it may help to alleviate some of the symptoms of memory loss and confusion for a period of time. Aricept is one. Exelon is another medication.
You see those on TV a lot.
Yes, yes. Namenda is one. I'm not a doctor, so I don't feel comfortable like really encouraging anyone to look for those medications. I more often tell families who call me and are wondering to check with their family physician, because you want to make sure that the medication, mixes well with other medications their loved one may be on.
Right, absolutely. Yeah, that's real important.
So what may help one person may not help another. But there are, that's a constant area of research that the Alzheimer's Association is involved with, is trying to find medications that can slow the progression and hopefully maybe one day prevent the disease.
Okay. Let's say with regards to the Alzheimer's Association that you guys are a part of, what does the association do, and what kind of, how can people reach you folks?
So we have 5 core services. Our first service is information and referral.
Okay, we have something on our screen right now that people can see.
And so basically, even if you're maybe noticing some of the warning signs that we just discussed and you would like to know what are some geriatricians or neurologists that are available on an island, you can give us a call. We can give you a list of doctors that you may want to look into, or adult daycare centers or other resources. We also have educational classes and presentations, and we have what we call our What Now series, which is a free family caregiver classes, and we talk about a range of topics including understanding the disease to legal and financial planning, managing challenging behaviors, communication, and so forth. We also have support groups. So throughout the state we have a number of different support groups. They're all for family caregivers. And then we also have our safety services, which includes our Medic Alert Safe Return program.
Well, we also have your phone number up there, and we're about to run out of time, and we wanted to ask you about one tip that you might want to leave our viewers with. You had one tip.
One tip would be to give us a call if you suspect that you may have Alzheimer's disease or dementia, because we can definitely point you in the right direction of where to turn for help.
Wow, okay.
Yeah, and I would say one tip is if you're seeing these symptoms of memory loss and some confusion, that's not a normal part of aging. So if you're seeing that and you're seeing it's enough to cause concern, call your doctor, get a evaluation done. That's the first step to take.
Okay, good. Well, that's about all the time that we have. So thank you very much for watching this program at this time about Alzheimer's disease and how to cope with it. And I want to thank our guests again from the Alzheimer's Association, and hope to see you again next week. Aloha.
Thank you.
Thank you.